Hi, everyone, and welcome to our virtual health series with UC Health. My name is Hannah Parrott, and I'm an event coordinator here with the Highlands Ranch Community Association. We are so excited that you all joined us this evening for our very special, important talk on tackling mental health issues. We are grateful for UC Health Highlands Ranch Hospital as a community partner and happy to host this wonderful event with their assistance. Before we get started, I would like to go over a few housekeeping items. During the webinar, your microphones will be muted. To ask questions, please type them into the Q&A chat box, and this can be found in your control panel. We will save the questions for the Q&A portion towards the end of this event. And our presenter this evening is Dr. Kristin Orlowski from UC Health. And without further ado, I'll pass the time off to Dr. Kristin.
Hi, thank you everybody for coming to check out this presentation today. We're going to be talking about mental health during the holidays and also the effect that the pandemic is having on mental health in the holidays. So, some reason, oh, there we go, it's just slow. Okay, so today we're going to be going through a few different things. So this is what our agenda kind of looks like. First, we're going to be just kind of reviewing some of the perceived positives and negatives of the holiday season, things that people talk about pretty frequently when I'm talking with them about the approaching holidays. We're going to be talking about mental health in the holidays, how the mind and body are connected, and how the mind and body are both affected by stress. Just talk about different coping strategies to help adaptively deal with the stress that the holidays bring about. Also helping to learn some strategies to help cope with the stress of the pandemic and the pandemic during the holiday season. And then at the end, we're going to talk about different means and ways for people to access help if they feel like they could benefit from that. So this is just a quote. I thought it was really relevant, especially with the holiday season here. But I really like this quote because a lot of people who are struggling with stress or another more formal behavioral health diagnosis, oftentimes people have the misperception that is it really real or not, because if you can't always see it, but people really, really do feel it. And it does feel very real to them. So this is just a list, again, of things that are commonly shared and talked about between people. So I just wanted to kind of talk about that for a minute. So some of the positive associations that people will frequently share about the holidays are, when they think about the holidays, it's a time to come together. It's a time to connect socially with friends, with family, to engage in traditions that people really look forward to: food and drinks and partying and creating joy and feeling grateful and thankful for things are all really positive things that people tend to associate with the holiday season. People really enjoy connecting with their faith. They enjoy the idea of creating lasting memories. They enjoy the festive activities that are associated with the holiday season. So all of these things are really positive attributes of the holiday season. But not everybody associates the holiday season with positives. There are quite a few negatives that people will frequently talk about when they think about the holiday season and as it's approaching. So some of those things include just having really unrealistic expectations about what the holiday season is going to feel like, having sort of like these idealistic ideas of these different events, and they don't always turn out exactly as people had anticipated, which sometimes causes feelings of disappointment. A lot of people feel really overscheduled during the holidays, and that can create some stress for people. I think most people are working off of some sort of a budget, and so sometimes when the holidays come about, finances can start to feel a little bit stressful. Sometimes just overindulging on food and alcohol can lead to stress. Not everybody is really excited to see their family and engage in all of these get-togethers that often occur during the holiday season. And more frequently, and especially since COVID started, people have experienced a lot of loss and are really working on processing through some grief. So not only loss related people, family, friends, but a lot of people have been struggling with the loss of employment or the loss of housing, the loss of other important things that help someone to feel secure and safe. So this is a season that many people also really struggle to work through those feelings as well. So just some interesting research that's come about related to mental health, specifically during the holiday season. So the APA came out with a study suggesting that 38% of the people in that study reported increased stress during the holidays. And that number increases even more for people who have any pre-existing mental health conditions. So the study by NAMI suggested that during the holidays, people with pre-existing mental health conditions, that their symptoms and their symptom presentation increased in 64% of those people. So for example, people with histories of substance abuse, depression, anxiety, chronic physical illness, chronic sleep impairment, those symptoms worsened in 64% of that people in that study. So I wanted to talk a little bit about the idea of toxic positivity and the phrase, it's okay to not be okay. So that's a phrase that I feel like has become a little bit more popular in the last few years. Maybe some of you are familiar with it. But the idea of toxic positivity is this notion that irregardless of the situation, people are sort of expected to just be okay, that people are sort of expected to not be stressed, even despite being in a really stressful circumstance. And I think when people are expected to maintain this sort of really stable composure, it increases stress because it's not always a really realistic notion that people can live up to. That's where it's okay to not be okay comes in, this notion that whatever you're feeling in whatever situation is normal. It's a normal reaction, and that if you're in a stressful situation, that it's okay to feel stress, and that's just a really normal and valid reaction. So when research talks about the holiday spirit, which brings about feelings of gratitude and giving and thanks and joyfulness, all of these feelings really help to build a sense of resilience for some people. So even despite the stress of the holidays, getting into that so-called holiday spirit sometimes can act as a protective factor. So despite the stressors, good or bad, when a person is sort of engaged with this sense of holiday spirit, they have this resilience that helps them return to sort of like their baseline level of functioning. So it can sort of be perceived as this protective factor that helps a person regain a sense of resilience, which is pretty cool. I wanted to just take a moment to kind of just distinguish between what's called holiday blues versus depression or seasonal affective disorder, SAD. So a lot of people coming into the holiday season because of the increased stress will occasionally have maybe a few days here and there where they just kind of feel down. They just don't really feel like themselves necessarily. That might be considered some of the holiday blues, just approaching the holidays, feeling the effects of stress physically, mentally, emotionally, and just not really quite feeling totally up to par. Usually people in that kind of a situation, as long as they have adequate coping skills and a really good support system, they're able to pull themselves out of it, and it's not something that feels significant or significantly impairing, and they're usually able to kind of pull themselves through that. That is compared with depression or a major depressive episode where you're having symptoms such as sadness, hopelessness, fearfulness, guilt, shame, low energy, low motivation, changes to your appetite, feeling symptoms of anhedonia or just a loss of pleasure in things that used to feel really pleasurable, and some of these other symptoms most days for at least a 2-week period of time. So if you're experiencing many of those symptoms of depression that I sort of just described, and you're experiencing them most days for at least a 2-week period of time, and you tried using your coping skills and you tried using your support system, and you're just not able to get out of that, that's where I would say it might be a good time for you to seek out some help with a licensed provider or someone else who can better assist you with those symptoms. Seasonal affective disorder is something that happens seasonally. So it really involves a person who has experienced a major depressive episode, but primarily during the fall and winter seasons, typically when it gets darker for longer periods of time, and that they've experienced really this onset of depressive symptoms lasting at least 2 weeks or longer, primarily only during the fall or winter seasons. And then those symptoms tend to remit during the spring and summer seasons when it's become lighter for longer periods during the day. Again, if this is something that you find that you're experiencing and this has become a pattern for more than 2 years, I would suggest reaching out to a support person and seeing if you can get some help with that. So there's a difference between stress and anxiety, and I think sometimes those two terms can be used sort of interchangeably, but really there is a pretty big difference. So stress can be good or bad. I think just during one of our first slides we talked about there's a lot of positives and there's a lot of negatives when we think about the holiday season coming up, and either one of the things on those lists can create stress. So if you think about, let's say, like a person starting a new job, it's really exciting for most people, but other things can also feel really stressful, right? Losing your job, as an example, can feel really stressful. So stress can be both good and bad. It really starts to become sort of diagnostic anxiety, if we're going to talk, for example, like generalized anxiety, when the symptoms of stress start to be experienced as symptoms like worry, nervousness, irritability, poor concentration, muscle tension, fatigue, symptoms like that lasting most days for about a 6-month period of time. Anxiety can be other types of anxiety as well, like panic disorder, where you're having more physiological response to the anxiety. So chest pain, chest pressure, increased respirations, feeling kind of dizzy, nauseous, things like that come on really suddenly and then tend to dissipate. The difference between stress and any type of an anxiety disorder, regardless of what type of anxiety disorder it is, really the primary difference is how prolonged and pervasive are the symptoms, how significant are they, how acute are they, and how impairing are those symptoms and the presentation to a person's level of functioning. So when we're talking about behavioral health, the mind and the body are really, really intertwined. It's really, really hard to talk about one without also talking about the other. And when you talk about behavioral health, it affects literally every aspect of a person's life. So it affects a person's biology. For example, a person who's depressed might experience decreased appetite or decreased libido, decreased energy. A person who is anxious might notice that they have increased muscle tension and restlessness. So it affects a person's biology physically. It affects a person's psychology, meaning their emotional, their cognitive experiences. It affects a person's ability to engage in their social relationships oftentimes as well. So a person who's depressed might be a little bit more withdrawn. A person who's anxious, for example, might feel a little bit more irritable towards people or might have a harder time concentrating when they're in a conversation with someone. So behavioral health really does affect a biopsychosocial functioning for a person. Again, it's when we're talking about things that are diagnostic, we're talking about a level of clinical significance, and we're talking about having clinically significant impairment in a person's level of functioning. So this was a really cool pictograph that I got off of stress.org, and I really liked it because it really helps to create that picture for you. So it really helps to kind of just give you an idea of how stress really does affect every part of you. So as an example, we know stress can affect your sleep and impair your ability to fall asleep, stay asleep, or get restorative sleep. That's insomnia. Stress can affect a person by increasing tension headaches or causing heartburn or increased heart rate or causing stomach aches. A person frequently will, say that they're kind of dizzy or nauseous, or they just have a pain in their stomach. It can decrease a person's libido. So all of the things that you see on this pictograph are examples of how stress can affect a person physically, which just kind of goes to show that stress affects the mind and the body. So how do we have a merry and bright holiday season? I think it's really important for everyone to sort of consider what makes you happy during this season. What are some of the priorities, and really try to be intentional about your time, who you spend it with, and how you spend it, and what you're doing. How can you effectively transition from work mode into holiday mode? Sometimes that means it's a matter of being really intentional with scheduling your time. So if you know that you're going to be taking a few days off of work, maybe that means the day before your last day, you can, if you have the flexibility to do so, can you structure that last day of work by giving yourself some time to sort of follow through on any unfinished business. So completing any tasks that, or at least getting them to a place where you feel okay about kind of putting a pause on for a few days. And then, creating some time at the end of the day, just blocking some time if you can, to just kind of touch up any loose ends, to, put your out of office message out on your email. And then also think about creating space when you return to work. So scheduling like the first day that you return back, scheduling some time to just kind of look at your schedule, reacquaint yourself with whatever projects that you are working on. Could be that you are setting up some time to just kind of like look through your day to respond to any emails that need to be responded to. But there are things that you can really do to help you just transition into that holiday mode so that you can really maintain presence when you're not working, and you can be present with your family and your friends and however you would like to spend your holiday time. I think it's really important to give yourself permission to rest. So many of us are overscheduled, maybe just during the holidays, maybe all the time. But we tend to be really good at overscheduling ourselves and getting really, really busy, and then forgetting that prioritizing our self-care and time for rest is really important. I don't know about any of you, but I know my whole month of December, there's a lot going on almost every weekend, but it's really important that you plan a day or a few hours, whatever you feel you need to support yourself, that you have time to just rest and take care of yourself. Be intentional again with your time, who you spend it with, because the holiday season should feel meaningful to you in whatever way that means or that looks like for you and your family. But I think when we can be present and we can be intentional, it really helps decrease stress. And also by creating boundaries for ourselves, boundaries, with regard to our schedules and events that we're participating in, that can be really, really helpful at getting us through this holiday season with less stress and really feeling more merry and bright. So these are just a few ways to help reduce holiday stress. I think there are some additional things to think about, especially since we are living in a COVID world. So not only that, but we're also in the middle of cold and flu season. So it's just important to help minimize any risk for accidental exposures to any type of illness. Reducing holiday stress can be accomplished by trying to use your schedule, trying to organize your time, planning ahead for things, prioritizing, again, your self-care. Just be really aware of what are the things that cause you to feel stressed so that you feel more proactive rather than reactive in response to those. This is a season of gratitude, so I think it makes a lot of sense to really prioritize time to think about what you can be grateful for, thankful for in your life right now. Trying to maintain a budget, that's one of the things that creates a lot of stress for people. So if you can maintain a budget and try to stick to that as much as you can, that will really help to maintain an appropriate level of stress for you to feel containment of that. Manage your time, again, refrain from overscheduling. I think it's also really helpful to just practice acceptance. There are going to be things that you have control over, and I think it's really helpful for you to focus on that. But there are things that you don't always have control over. And so I think the more that you can accept that and kind of roll with it and try to be flexible, the less stress you're going to experience. For a lot of people, decluttering is really helpful, and it seems a little bit counterintuitive because for many of us, we take out all of the holiday decorations and everything else comes out, and sometimes it can feel a little bit more cluttered than normal. For families, what's been helpful with this, especially families with children, is they will kind of clear out any old toys that are no longer being used. They'll donate those, kind of clear out the way for anything that might be coming into the house, so that feels a little bit more organized and controlled. Additional strategies to help reduce stress during the holidays, really prioritizing relaxation techniques. So this could be making use of deep breathing exercises, progressive muscle relaxation, guided meditations. A lot of people who I work with really like the Calm app. It's probably the one that I hear about the most that people really, really like to use. It has a lot of just guided meditations, and it'll walk you through different breathing exercises, or I think it has nature counts and things of that nature that can be really helpful to reduce stress, to reduce anxiety, to help a person sleep better at night too. Delegating tasks. You don't need to be responsible for everything. Sometimes you can ask a spouse or a partner or children or friends or other family members to help out with certain things so that you don't feel the pressure to take on so much alone. Again, focusing on healthy eating, everything in moderation. So for a lot of people, it involves traditions that include eating and drinking. And I think if you can maintain control of that and everything in moderation, that could be fine for most people. But I think that it's really easy to eat a few too many cookies or other holiday treats. And that can lead people to just feel more stressed because maybe they're not feeling well, they have a stomach ache, maybe they have a headache, maybe they're worried about their weight control. So making sure that you try to maintain that as much as possible will help to reduce and contain any stress. Getting into nature is a really, really helpful way to help a person just feel really grounded, especially when there's a lot of stress going on in their environment. One of the things that I recommend quite frequently for people who especially are really anxious, and again, what we've talked about earlier is sometimes stress can lead into symptoms of anxiety. And so using grounding techniques, especially outside, can be really, really helpful. That will decrease the hyperarousal associated with symptoms of anxiety. So one of the strategies that a person might think of using if they're feeling a lot of stress is put their shoes and their coat on, try to go outside for a walk for a short while and kind of just take it all in, right? So use your senses, think about everything that you're seeing, all the noises that you're hearing, if you're smelling anything in the air, really try to make use of all of your senses. And that really helps to bring you back into the moment. It helps you to maintain presence, and it will help to ground you and decrease the arousal associated with any stress. This is also sort of the holiday season is often associated with acts of altruism. And what we know about altruism is that it's not always completely selfless, because it feels good to help others. And so if you can do something, some sort of acts of service to help someone else, that really does help us feel better as well. And I'm going to say this kind of throughout the presentation today, but anytime that you are starting to feel really overwhelmed, like your normal coping strategies just aren't adequate, or you're really just having a hard time pulling out of the stress that you're experiencing, seeking support. That could be a friend, that could be a family member, that could be someone from your faith, a provider, that could be anybody in your community who you might feel supported by. But I do really always encourage people to seek out support, especially with increased. So holidays during COVID. This has been really, really interesting. So last year was the first holiday season that we experienced in COVID. And last year, for many families, people were still kind of really isolating and really kind of sticking to their more immediate families. There was less travel. And this year feels different. In a lot of ways, I'm hearing about a lot of people having COVID fatigue, right? So we want to be very careful and cautious, but people are really needing to feel connected. And so I've been hearing a lot of people make decisions that they are going to travel, they're going to go see family. And I think that when we think about this, because COVID in itself has caused a lot of additional stress for a lot of people. So it's increased behavioral health issues of all sorts. It's increased suicidal thoughts, suicide attempts, intimate partner violence or domestic violence. It's increased people with chronic illness. Our home, job, health, security has been compromised during the pandemic. There's been all of these additional stressors, a lot of loss, and that's in combination now with the holidays and all the stress that the holidays bring on. So this year and last year in particular, people are under a lot more stress than they're usually under during the holiday season because they have a lot more to worry about and a lot more variables at play than they might have normally been having to cope with. So I think it's really helpful when we're talking about our normal range of stress, if everybody can sort of think about what their normal continuum looks like. So if you were to imagine sort of having a scale, and 0 would be no stress whatsoever, you're feeling the best you've ever felt, and 10 being the most stress that you've ever felt in your whole life, and a 5 would be, moderate level of stress. For a normal person, their baseline is like a 1 to a 3. It's typically in the mild range in terms of stress, and occasionally they'll have a day where there's a bigger stress, but the day-to-day stresses are typically more in the mild range. But then when you add on the stress of the pandemic, and then you add on any stress related to holidays, that baseline might be creeping up a little bit, right? So your norm might not be the 1, 2, or 3, it might be closer to a 4 or 5. So I think it's really important as we go into the holiday season that we really start to think about whether our symptoms are escalating, where we are in our continuum, and what we need to do to effectively cope as we're noticing the increase in symptoms. So what I always say is, can you practice mindfulness, the idea of just being present with yourself by doing frequent check-ins with yourself throughout the day, and ask yourself, where am I on this continuum? How am I feeling mentally, physically, emotionally? Is there any need I can take care of right now? Because what you do when you practice that mindfulness is you learn what coping strategies are effective for you at what given point on your continuum, on your scale. But you also help start to develop emotional tolerance to stress. You start to kind of gain confidence in your ability to tolerate whatever is happening because you gain confidence in your ability to appropriately and adaptively cope with that stressor. So I think that that's really, really helpful and important for everyone to kind of keep in mind as they're kind of going through the rest of the holiday season. In addition, again, be mindful of your emotions and how you're feeling. Acknowledge the loss. For many families, this is the first or maybe the second year that they're grieving someone in their family, a close relative maybe who they've lost. And so acknowledging that loss and providing yourself some validation that if you're not feeling completely up to par, that's probably normal. Given the situation, and if it's not normal, and if it's been sort of a prolonged experience, again, seek support and get some help for that. I think it's really helpful to just have acceptance of all of the good things that come along with the holidays, but also some of the perceived bad things that might come along with the holidays as well. Accepting just the differences in people and differences in expectations, and trying to approach things with curiosity rather than judgment. Again, trying to find things to be thankful for, using your supports, trying to set realistic expectations of what something is going to be like for you, going into things rather than having these idealistic, sort of perfectionistic expectations or agendas. We know that that's rarely lived up to, and that causes feelings of disappointment. And so really trying to be realistic can help to contain symptoms of stress. And then trying to maintain routine and consistency. This is really, really important, and especially because during the holiday season, people have a lot more scheduled than they might normally. And so maintaining some routine and consistency with things like what time you're going to bed and waking up, what time your meal times are, what days or times you're normally exercising, anything else that would be sort of a normal standard in your routine and in your schedule. By maintaining those as much as you can really helps to promote a sense of security and can help to reduce stress. So that's really, really helpful. And especially during times when other things might feel kind of chaotic and busy. And then I think especially during COVID times, using technology to connect is just a really, really helpful strategy. So I wanted to put some information on here just to help any children during this holiday season and during a pandemic. So last year during the pandemic, a lot of kids were required to engage in distance learning for school. This year, many of the schools, I believe everybody is back in person learning, which for many people has felt like a really, really positive thing. But for others, I worked with a lot of people, not only children, but adults as well, who really, when they started working remotely from home or they started staying at home and not going to school for long periods of time, it affected their comfort level in social situations, not just because of a fear of getting physically sick, but because they just were no longer used to engaging socially the way that they had prior to the pandemic. And so it created a lot of anxiety and nervousness and stress when people then had to be sort of reacclimated back into those work and or school environments. And so I think just helping children and or adults adjust back into the in-person environment can be really helpful, especially during the holiday season when people sort of have expectations that you're going to come together and to socialize and embrace each other. So I think just focusing on that and being mindful about people's comfort level in those situations can be helpful. Recognizing that there's a change in pace, especially from last year. So last year, again, many families were staying home, really just celebrating with their immediate families. And this year, I've noticed a lot of families really wanting to return to some of their older traditions, maybe larger gatherings, things of that nature. And I think it's important to prepare children if things are going to feel different, or if you're not planning on getting together with any extended groups of people and you're planning on using technology as a resource, helping children really understand if that might feel different for them. Developmental considerations, so things to think about in terms of just increased stress. The younger the child is, the more behavior you're going to be experiencing because they don't always have, depending on the age, they don't always have the ability to really understand their feelings or to sort of effectively communicate or verbally communicate how they're feeling. And so the younger they are, the more behaviors you might notice in them. Of course, as children age, they can more appropriately verbally communicate with you what's going on. As they get into teens, you might notice behavior again in terms of like isolation, withdrawal, not being kind of snippy or not wanting to talk. All of these would be symptoms of increased stress in children and or adolescents. And I think it's important to just let them know that you're there and help them cope in whatever way feels most appropriate. So if you are a parent, I imagine some of you are, and you're thinking about just parenting strategies during the holidays, during the pandemic, it's really important to try to maintain communication with your children, try to just normalize any differences that they might be experiencing or associating between this year and last year and any stress that might be provoking for them. Try to maintain a solution-focused perspective. This is really, really useful because it helps a person to maintain a sense of control and really to have just awareness about what control you have over any given situation, recognizing that there are things that you're not going to have control over. but usually there's something that you can control, even if it's not the thing you ideally really want control of, but maintaining a sense and the perspective that there's something that we can do about this is really helpful in stress management. Maintain traditions when possible, and if that's not possible for whatever reason, are there any new traditions that you can consider that might really feel meaningful and appropriate to your family? Maintaining, again, that structure, that routine is going to help to contain any significant symptoms of stress. Trying to be present in the moment, not overcommitting. I read a research article a while back, and it was about the idea of mindfulness. And it was way back when iPhones first came out, so I don't know, maybe a decade or so ago. And during that time, there was a new app that basically had participants like answering a few questions every so often. And so the participants were asked basically, what are you doing right now? What are you thinking about? And how are you feeling? And the results of that research were really, really interesting. At least I think they were, because basically what the research suggested was that a person who is present and engaged with what they're doing in the moment rated their mood to be far more positive than people who weren't present with what they're doing. For example, if they weren't engaged in a certain task, but they were thinking about the thing that they have to do next or the thing that just happened before, they rated their mood more negative than people who were really just present in the moment, thinking about the thing that they were presently doing. So we know that mindfulness really, really does have positive effects on a person's mood. So this is really important. And then trying to just maintain a calm presence and composure. We know that our children really feel our energy. They feel our moods and they internalize that often, especially younger children. And so trying to maintain calmness and try to model really appropriate and healthy coping for them, offering lots of validation. If they're having feelings, then that's okay. Then let's talk about that and let's figure out what we can do. If we can change anything. So holiday safety during COVID, I feel like I don't necessarily need to go through all of these. I'm sure all of you are very familiar with all of the safety precautions during COVID at this point. To consider, when you're thinking about safe ways to come together to celebrate without compromising your safety. One of the things though that I want to pay special attention to is there always is the recommendation, like stay physically distant, maintain distance, especially indoors, but maintain emotional closeness. And I really, really like that because there is a way to be physically distant and emotionally close. So to still feel that connection that so many people are really, really searching for right now, especially during the holiday season. And that's accomplished through being present with the person in a conversation. Really trying to actively engage and actively listen and hear that person and engage and respond to them appropriately in that conversation. It helps a person to really feel heard and connected. So I think that that's just the one that I really want to focus on off of. So for any of you who might be interested in just kind of understanding a few ideas of where you can access help if you feel like you could benefit from it. Integrated primary care, I work in integrated primary care settings, and UCHealth is a really, really great way for you to access support if you need it. You go into your primary care office. Many of UCHealth's primary care clinics now have integrated behavioral health therapists. So you can talk to your primary care and you can ask them if there is a behavioral health therapist available who you might get referred to. Then you can be seen in the same office, and the therapist and your primary care provider can coordinate very effectively with each other. So that's a really, really great way. Of course, there are private practitioners. I always recommend a licensed provider. Community mental health, your clergy, your faith are good sources of support, and then other support systems within the community as well. So think of your friends, your family, any other community resources that might really feel helpful to you. I always just think it's important to put this information up here for anyone who thinks it might be meaningful or helpful to them. These are a number of different crisis lines essentially that are available 24/7. You can call them anytime and talk to someone who will be able to assist and support you if it's imminent or if it's an emergency. All right, so we have some time for questions. What questions do we have?
Thank you. At this point, we don't have any questions. Attendees, as a reminder, if you do have questions, please type them into the chat box and we will read the questions out loud. We'll wait another minute or two to see if we get any questions. All right, I do have a question for you, Dr. Orlowski. You explained everything so well. It's hard to think of any questions. No question there.
Thank you.
All right, well, there's still time if you'd like to type a question, but we really do just want to thank UCHealth for the opportunity to learn about tackling mental health from Dr. Kristin Orlowski. And thank you to all of those who joined us tonight. Our next virtual health event will be on Wednesday, January 5th on heart health. And thank you again for joining us and have a great rest of your night.
Thank you. Bye.